Hey everyone. Today I wanted to kind of touch upon something that doesn't get a lot of spotlight, I guess. Something that a lot of people don't talk about in regards to, first responder stress and some of the other possibilities, I guess. A lot of times when we do talk about mental health, mental wellness, the stress of the job, burnout, we tend to focus on like anxiety, depression, suicidal ideation, suicide, attempts, and unfortunately some successes. We focus on that stuff, which is I guess the obvious part of the mental health crisis, right? One of the things that I have unfortunately been privy to has been the physical effects. So beyond the depression, beyond I guess beyond the obvious stress parts. And so I want to talk about that today. And that is really the early cardiac disease, the early onset cardiac disease parts that a lot of people don't realize are part of the stress of the job. And we see quite a bit of it. We don't see it related or talked about in a sense of it being related to burnout or stress on the job, but we see younger members of the first responder community, dropping, so and so age 39, found dead in the bunk at the firehouse, or not even on the job, not currently on shift, and not after a big fire. 44-year-old so and so, massive cardiac event at home, and these days, for the last 20ish years or so, you've had the 24-hour clause, at least with the fire service, before or after a shift you have a heart attack, it's considered a line of duty. And a lot of people associate, especially the after the shift part, if someone has a heart attack, so they worked really hard. Um, what they're finding, and this is research, I'm not going to give you a bibliography on where I get these from, but you can look it up. There is some research being done that a lot of these younger members that are having these cardiac events, and I am one of them, is because of the unresolved trauma from the job and holding this shit in. And so I'm going to give you, a personal testament to this, as I always do. So for a very long period of time, almost 10 years, about 8 years, from about 2009ish, 10ish to about 2018, I was having a lot of cardiac events, a lot of cardiac mimicking events. And I can tell you probably 18 times I ended up in the ER for different types of chest pain. I think in all the times that I went and all the times, doctor checkups, going to cardiology and different stuff, I think I threw enzymes once. So my troponin was elevated once. Blood pressure maintained pretty normal stuff, but at times was slightly elevated, especially when I was in crisis. Pulse would always be elevated because I think most of us in the first responder world who deal with stress operate probably on the higher end of normal, if not the lower end of abnormal. Um, but there were some, some occasionally EKG changes, and the biggest thing was I wasn't doing good with stress tests. So for me, in 2018, February, I ended up having such significant cardiac related events that I had the entire cardiology team at Catholic Memorial Center out of Manchester convinced I had a blockage. There was so much going on. There was so many signs and symptoms of cardiac events that they actually put me on, gave me an exploratory cath, which ended up being unfounded. It was, let's just say I have a subway system for coronary arteries. They were free and clear, because it was all stress. I was holding so much in that I was mimicking cardiac symptoms. And the one thing the cardiologist, the actual doctor who did the cath, told me was, okay, so your troponin wasn't elevated. Most of your vital signs were sort of, within normal limits. You don't have a bunch of evidence of, your EKGs being off the wall, besides the bundle branch block, which I have. No arrhythmias, so to speak, but you're still putting your heart under stress. And what they're seeing with the research they're doing and the tie-ins they're doing with people who are volunteering their medical information for these research, like I have, is that a lot of, especially men, in the first responder role, specifically the fire service and police work, are having these early onset cardiac diseases or events because of repressed stress, and not even repressed, because we're not repressing it well. We're not. We may be on the outside, looking okay, but in the inside, our heart and our system is going ballistic. We are always on, and that's part of what, a lot of what I talk about, folks. When with all these videos, with what I post, with what I talk about when I get on stage, with what I get on podcasts, whatever it is, you know, me and people like me, we talk about being able to talk about the stress from the job, the traumas we see, and this is why it's not just the guy who's pissed off all the time or stressed out or seeing the therapist. It's the people who aren't doing that, who are then having heart attacks after shift, who are then maybe not even on the job anymore and dropping dead. I mean, my people around New England, we know this, and we've had some people recently that we were very surprised by that just dropped. And it's happening more than it's being reported, more than it's being, I guess, more than most of us will know, because we're not going to know every first responder that has a cardiac. That's not the point. But we all know a number of people from the job that for some reason just all of a sudden started having cardiac. They're always having chest pain. Why do you think that is? What do you think that is? And this, it's not funny, but at the same time, I get to the point with all that I do with this, that like it's like, where are you people trying to fool yourselves on purpose? Are you trying to dismiss what this all really is? We have to be more proactive with our mental health and what ultimately would be our physical health in this job. I can tell you right now, and I can confidently say this: if the resources that are around, and even some of them that have been around, were available to me, and I was supported in getting these resources back in the beginning of my career, I can almost promise you I would still be on the job, because I do love the job. I probably wouldn't have had almost 9 years of consistent cardiac events, ER visits for chest pain, and ambulance trips, having my coworkers work on me. And I would probably have gone through less anger issues. So many of us in the first responder world, as much as there's not a lot of, there's a lot more now, there may not be a lot of, oh yeah, I see a therapist, or oh, the other jobs affected me. Think of the other things that are happening, that we are seeing: the alcoholism, the divorce, the people who should be being promoted that aren't, because, well, management doesn't want them to be promoted, or the hatred for the job that ends up happening, or the violence that ends up happening. And as much as I back the blue 365, a lot of what we're not seeing is law enforcement receiving the post-incident support they need. So maybe they're not carrying some of the stress of the job into a situation that gets escalated more than it needs to. And I'm not a cop. I'm not trying to Monday morning quarterback anything, but I have a lot of close friends that have been in those situations that tell me these things, and I believe what they say. A lot of the stuff from the job that happens to us on the job, and a lot of the situations that arise on the job, can be mitigated, navigated, can be maybe even avoided if we start dealing with what we are seeing. And I say this all the time. I haven't met someone yet that got on the job thinking they weren't going to see bad shit. I got a buddy whose 18-year-old son's now on the job, and he knows he's going to see bad shit. The key component here is, what are we going to do when they see the bad shit? That's clutch. And it's weird for me to be in the part that, now of 26 years ago I got on the job, right? That's a long time. there's now an entire generation on that we need to help protect. We need to help them have the tools and the support that they need to be able to use those tools to have a better career, to not have a cardiac event when they're freaking 38 or even 45. I mean, if they have inherited cardiac disease, that's one thing, but the stress from the job should not be causing people to drop as much as it is. And one of the things we lack as a society now, as you know, fire and EMS, we're very medically focused for the most, especially these days. And I hate to, bust all the bucketheads bubbles, but you're doing 75 to 85% medical runs than you are fires. I mean, you are. Fires are on the rise, sure, in some bigger cities and stuff, and they are on the increase overall. But for the most part, in your day to day, you're doing medical stuff, and we all know the medical stuff. We could pick up on the signs and symptoms of our patients when you show up with he's having a heart attack. You know what I mean? And we show up to someone having a panic attack, which for anyone who hasn't had one, it is almost the same feeling when you're having a panic attack as it is if you're having a heart attack. And you are still putting your heart into stress. Your heart may not have a blockage. You may not be throwing arrhythmias. You know what I mean? But you are still under that amount of stress. We can pick up on that, but we can't pick up on it with our own brothers and sisters or ourselves in the job. And we're sitting here and we're repressing these feelings and we're repressing the traumas from the job, and we're like, oh, whatever. And then the poop hits the fan, and then we maybe deal with it. Why are we waiting? Why can't we use some of the resources that are out there right now to proactively talk about these things and have healthier departments, healthier officers, healthier firefighters, cops, EMTs, dispatchers, correctional officers, and veterans? Why can't we think of what we see day in and day out? I don't care if you're on a big department, New York City, LA, whatever it is, or a small rinky-dink department does 300 runs a year. You're seeing something. It only takes one really bad call, and then knowing that there's a chance to see another one that same day to affect you. What we do is very unique. Our symptoms aren't necessarily unique, because PTSD is PTSD to a point. However, the fact that we day in and day out subject ourselves to stress, and now that could be the calls, right? The prospect of calls. If you're on a system that you're going to bang out, 14 calls a shift, that's a lot of stress. That's a lot of anxiety anticipating those calls. Now, you may be a shining star when you show up on scene, and a great leader, command, whatever it is, provider, and you're like, boom, 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 boom. This person goes here. We do this. This fires out. We go to, A side, B side, exposure 2, whatever it is, whatever you do, you may be in the moment doing very well, and maybe you're not. I talk about this sometimes too. Read some of the NIOSH reports on some of the firefighter line of duties. I don't get into the police line of duty ones, because honestly, these days it's way too sad, because I'm going to be honest with you, and you can argue this with me, cops being targeted and cops being murdered. And I don't stand for that. And I don't need to read a report to tell me that. But firefighter reports on line of duties are all public knowledge. You can look them up, NIOSH reports. And how many of these, now the ones that are actually like fire scene ones, we'll stick with that. How many of these are by bad command decisions? And I don't mean the incident commander. I'm talking, maybe it's the incident commander, maybe it's the interior ops, maybe it's second floor ops, maybe it's ventilation ops, whatever it may be. How many of these are made judgments of error because people aren't thinking clear, because the stress is always there, because we're such a culture that we're not dealing with this, that some of the people that are in command positions or authoritative positions, captains, lieutenants, deputies, whatever it may not be navigating their brain enough to be making correct decisions on life safety measures, putting members in unnecessary, and I'm going to get backlash on this, unnecessary danger, because we have to go in and do this, or whatever it may be. Or maybe not thinking, and this fire has been burning for a period of time, we're putting guys on the roof. Why? I mean, a lot of some of the things that happen, if you read some of these NIOSH reports, they go into the full incident. They'll go into the matters that led up to the death of that person. And And then there's other sites you can go into to get more logistics on the event. A lot of line of duties are due to bad um, errors in judgment in command decisions. And I don't want to get specific with any of them, but there are a lot of times that we make decisions in the fireground or emergency scene that may be clouded by a stressed brain. And we need to start accepting the fact that this job, all the jobs, a first responder job, are stressful jobs. The burnout rates are astronomical. You got a better chance of not finishing a full career than you do of finishing it. You got a better chance of ending your own life than you do being killed in the line of duty because of how stressful our work is. It's not even that it's dangerous in the sense that as a firefighter that you're going to go and get burned up in a fire. That isn't happening like it used to, folks. Let's just call a spade a spade. All right. You can sit there and go to the bar and tell all the ladies that you're a fireman and that you eat smoke, and they're going to be like, ooh, and that's great. But let's face fact here, and it's all public information. Guys, men and women just aren't dying in fires like we used to. And that's good. What is killing us is the stress, the cancer. And there's a correlation between stress and cancer. All of it is early cardiac onset stuff. Like all this stuff is what's really killing us. Why can't we try to stop some of that? We're not going to prevent it all. But if we can prevent some of it by talking about it proactively, talking about, hey, having these initial academy, trainings, having these quarterly or weekly on, full-time departments or whatever it is, navigating and breaking down the uncomfortability that it is with talking about the stress in the job. If it becomes common conversation, it's not going to be as hard to talk about. And what's the big deal? What's the big deal? You're still going to go to the next call, right? Talking about how the job is affecting you ain't going to stop you from doing it. If anything, it's going to give you more confidence to do the job better and wanting to do it better, wanting to excel, wanting to climb that promotional ladder, wanting to give back, wanting to maybe get into more training, maybe wanting to further educate yourself, maybe wanting to push the agenda to talk more about mental health because it is part of the job. I'm sorry, folks. Like fire is part of, like having ladders on trucks is part of firefighting. Mental health and stress is part of firefighting. It is. You can't avoid it. And there's numbers out there for how much this affects us. I was part of a study that said that, out of 100 male firefighters, that had either PTSD, diagnosed PTSD or symptoms thereof, 70%, 70, I think it was 70, 75%, but it was in the 70s, had childhood trauma as well. Like this stuff is there. It is there. And they did not have to search very hard to get 100% participants that had PTSD out in Massachusetts. Like we have it, folks. It's there. We have to talk about this. It doesn't make you a less aggressive firefighter or a less aggressive cop or a better provider or a better dispatcher or whatever it is, whatever your title is. It doesn't. By owning your mental health, by being proactive about it, whether you're using coaching or whatever you're using. Coaching is a great tool because it builds on conversation, and coaching essentially is leadership building. And all of us want to be better leaders because in society, you have maybe a few opportunities to be a leader in a situation or to be in control of a situation, so to speak. Day in and day out in the first responder world, we are in charge of situations. We are navigating and mitigating situations, in command of situations. Even if it's not a full-scale mass casualty incident, you show up in an ambulance to a scene, you're automatically in command of a situation. You're navigating and triaging and figuring out what needs to happen, what this person needs, long-term, short-term, what hospital they should go to, what care they need right there, acute, long-term, whatever it is. We are constantly have the weight of the world on our shoulders, and we need to start better navigating this in a proactive way so we can have better, more confident, safer leaders and people in control of other lives. So maybe we can start reducing some of the unnecessary line of duties. We can start having less early onset cardiac symptoms and stress-related deaths, less suicides, maybe even less cancer-related things, because there is correlation and research being done between stress and cancer. All these things can be reduced and helped, and even in some cases avoided by talking about it. So that's what I want to talk about today, because I don't think I've touched on the cardiac part, the early cardiac onset stuff yet. So I want to talk about that. And I tied in other things, for a reason. And I want you guys to think about this stuff. Take it back to your departments. Talk about it with the senior guys. Talk about it with the new guys, especially. Make sure these new generations coming in the door, which another touch point, all departments having a hard time getting bodies in the door, having a hard time keeping them in the door. Maybe we start talking about this. Maybe we start making each other feel supported and that we're not alone when it comes to what the job's going to inevitably do to us. Talk about it. Again, I'm always here, guys. You can reach out to me. I don't mind being a resource. I actually love talking about this. I can come out and talk about it. I got a bunch of stuff coming up this fall, bunch of big conferences that I'm a presenter at. I've given the updates on like the film and the book, and I've actually been asked to actually be part of another book, which I'll get into in another video. I am working on an article for Fire Engineering Magazine, which I'm hoping I'll be able to make it shine enough to get them to print it. Lots of good stuff coming up, guys. Trying to break down the stigma and trying to get all of us to be supported and to be able to talk about this stuff so we can have better careers, safer careers, longer careers, better personal lives, better marriages, better relationships with our kids, whatever it is, better health, just a better life. We've earned it. We do a job most of the population won't. Why can't we live a better life just by talking about the stress? So I love you all again. Thank you all for what you do, whether you're on the job, were on the job, going to be on the job. Thank you all. Thanks for watching these videos. Make sure you subscribe to the YouTube channel. Follow me on the Facebook, LinkedIn, Twitter, Instagram, all that stuff. And just keep spreading the word. Keep supporting each other. Take care, guys.